Thank you, Dr. Rajiv. I would like to add one more benefit into group practices. I can take Friday, Saturday, Sundays off when he is there to take care of the OPD. So that is one more added benefit of he being attached to our practice. Coming to our last topic, which is growing practice and dealing with the change in the Tier 3 city. So as we all know that there is an increased patient's demand, that everybody wants to have a 6x6 and N6 vision next post-operative day. So we need to keep ourselves updated. Like I started with, when I joined my father, I started my phaco with through a scleral tunnel. Then the next year I learned phaco with like clear corneal, and then I shifted to temporal, then I started doing under topical, and that is how I kept myself surgically updated. Third is providing amenities, like whenever, if supposingly I had to go to any of the hospitals, what things I will prefer is a clean, tidy, and non-smelly hospital. It should be spacious, it should be windy, it should have ample light, and the bathroom should be clean. So providing amenities into your private practice is a must. And also, simultaneously, every year you need to upgrade your instruments as well as surgical skills. Because you just cannot keep on with the same instruments, and you cannot give the quality service in the you cannot meet the patient's demands. So challenges that I faced when I joined my father were in a Tier 3 town was recruiting a trained staff. I would like to share with you something that it's an example like what happened with me. When I joined my father, I got an optometrist. He joined with me, and he had seen my growth, and what he used to do is every 3 months he used to tell me, "Sir, I want a raise in my salary, or else I'm leaving." So by the end of 10 months, his salary was at least 5-folds more than what he used to get it. And ultimately my father, he came to know that it was a kind of blackmailing. My father said, you ask him to leave, and the better he left. But then getting a trained staff is also a big challenge in a Tier 3 town. So now, as I told, we have started our own optometry college, but by that time, we trained our own staff to do all the things. There is nothing that they cannot do. So facing the upcoming challenges, that when I joined, there were hardly few doctors, but when I joined, along with me, few other second generation ophthalmologists, they also joined. So I needed to be ahead of my time. I needed to be more upgraded than updated than rest of my fellow competitors. So I set my systems, I set my protocols. Then it was the brand building. Brand is built by making, giving a quality service, and not by making advertisements. So once you know your subject, once you know what you are giving to your patients, the quality will automatically be developed, and this will act as a sort of a brand building, just like Arvind Eye Hospital. And finally was, should I invest? Like whether I am working in a Tier 3 town where the population is around 5 lakhs, 3 to 5 lakhs, and should I be investing so much into my population? But then yes, I would definitely say today, when I'm standing here, I would say that yes, you can invest into a Tier 3 town, and you will recur your money. 3 years back, we have invested in one of the most advanced LASIK machines in my town, which was the first in Maharashtra, you can say. And yes, I am able to give the quality service without compromising on the cost that I charge them, or without compromising into my services to the patients. So you should be investing in your hometown. There's no thing that if you know your subject well, you will be able to recur the money as well. So these are the protocols that we have set when I joined. This is something for neuro-ophthalmology. This is for glaucoma. So this is cornea. This is pre-operative workup for cataract, wherein you can see there's a area for the systemic illnesses, where we just take it for whether he's hypertensive, diabetic. Then there is a column for which eye he is going to get operated, A scan, K reading, IL, power, then tension, and a corrected IOP as well, and sac syringing and a trimming. And we do ask the person in charge to sign below over there whether he or she has done the sac syringing or trimming, just in case if we want to go back and see who has done it. So these are the protocols. This is something that I learned from Arvind, putting up stickers on the on your file, that once the patient gets in, whether he's a left eye, whether he's cardiac, whether he's asthmatic, diabetic, and what all things the patient requires the most. If he's allergic, maybe you can just avoid those allergic drugs. So setting up protocols eases your life, eases your work, and once your practice starts growing, these protocols are going to help you to maintain or to sustain your practice.